All right, today we're going to talk about something that I bet feels pretty familiar to a lot of you, carpal tunnel syndrome. You hear the name all the time, right? But it's also really misunderstood. So let's get into it and separate the facts from the fiction.
So, does this sound familiar? You wake up, maybe it's the middle of the night, and your hand is just buzzing. Or maybe it feels like it's completely fallen asleep, and you find yourself just shaking it, trying to wake it back up. Well, that right there, that's one of the classic signs we're going to be talking about.
And here's the thing, it's not your whole hand, is it? The tingling, the numbness, it's usually in this very specific pattern. We're talking the thumb, your index and middle fingers, and then about half of your ring finger. And that's a huge clue, because that's the exact territory of one very, very important nerve.
And you should know, this is not some rare thing. Get this, carpal tunnel syndrome makes up a whopping 90% of all cases where a nerve gets trapped or squeezed somewhere in the body. It is, by a long shot, the most common one out there.
Okay, so let's start with Section 1, Understanding the Impact of CTS. We're going to look at what this condition really is, and just how big of a deal it can be. So, here's the bottom line. CTS happens when that median nerve we mentioned gets squeezed as it passes through a really narrow channel in your wrist, the carpal tunnel. Just imagine a garden hose getting a kink in it. The water can't flow right. Well, in this case, that flow is your nerve signals, and that's what leads to all those weird symptoms.
And we're not just talking about discomfort. This is a massive economic problem. In the U.S. alone, the healthcare costs tied to carpal tunnel syndrome are more than $2 billion. Every single year. And that's not even counting all the lost time from work.
So let's move on to Section 2. We're going to take a little tour inside your wrist to really understand the anatomy behind this whole thing.
And this image here gives us a perfect cross-section. See, the floor and the sides of this so-called tunnel are made of the little bones in your wrist. And the roof? That's a super tough, thick ligament. The important thing to know is that it's a really rigid space. There's basically zero give.
Just how crowded are we talking? Well, imagine a highway tunnel with 10 lanes of traffic trying to cram through. 9 of those lanes are your tendons, the things that let you bend your fingers. And that last lane, that's the median nerve. There is just no extra room in there.
And if you look right here in the diagram, you can see the median nerve. It's labeled as number 10. See how it's sitting right on top of everything else, just under that tough ligament? Because of that positioning, it's the most vulnerable thing in the whole tunnel. Anytime there's a little bit of swelling, it's the first thing that gets crushed.
Which, brings us to the big question. What causes all that pressure in the first place? Let's dive into that in Section 3, Exploring the Causes of CTS.
Okay, so there are a bunch of well-known risk factors. Women are more likely to get it than men, and it often shows up between the ages of 40 and 60. Other big ones include obesity, a past wrist injury, and even hormonal changes, like during pregnancy. And of course, underlying conditions like rheumatoid arthritis or diabetes that cause inflammation can play a huge role.
But this is the million-dollar question, isn't it? If you're sitting at a computer all day long, typing away, are you basically guaranteed to get carpal tunnel?
Okay, let's clear this up, because it's a huge misconception. The common belief is that, yeah, typing causes it. But the scientific evidence, it just doesn't really support that. Now, using a keyboard and mouse can increase the pressure inside that tunnel for sure. But here's the key. It's considered an aggravating factor, not a root cause. It can make a problem you already have worse, but it's probably not what started it.
But get this, it's not just about what you do or your other health conditions. A huge piece of the puzzle might just be in your DNA. It turns out little variations in your genes, the ones that build your tissues or even protect you from inflammation, can make you more likely to get CTS. Some people are just born with a higher risk. It's kind of wild.
Okay, so you have the symptoms. How does a doctor know for sure what's going on? Let's get into Section 4, From Symptoms to Certainty.
One of the biggest clues actually comes from you. That thing we talked about, that automatic need to shake your hand to get the feeling back, well, it actually has a name. It's called the flick sign. And it's a really, really strong indicator. It's right about 93% of the time.
Then, when you're in the doctor's office, they'll probably do a few physical tests. They might press right on the tunnel, that's Durkin's test, or have you hold your wrists bent way down, that's Phelan's. They might even gently tap over the nerve, which is the Tinel sign. The goal of all of these is to see if they can bring on those symptoms you've been feeling. But to really get a definitive look,
they often turn to technology. Ultrasound is this awesome, non-invasive way to literally see inside the carpal tunnel. They can look directly at the median nerve and even take measurements. And that technology gives them a very specific number to look for. If the nerve's cross-sectional area is bigger than 10 square millimeters, well, that's basically the smoking gun. It means the nerve is swollen, and it's a strong confirmation of carpal tunnel syndrome.
Okay, let's get to the most important part in our final section, Section 5, and talk about what you can actually do about it, finding relief without surgery.
And the great news is that for most people, you don't have to jump straight to surgery. The first things to try are pretty straightforward. Modifying your activities and fixing your ergonomics is step one. Wearing a simple wrist splint at night is huge because it keeps your wrists straight while you sleep. Steroids can help calm down the swelling, and some special physical therapy exercises can also make a big difference.
And honestly, for a lot of people, this stuff really works. You can see major improvement in just a few weeks or months. So no, surgery isn't always where this story ends.
So when you think about it, carpal tunnel syndrome is rarely about just one single thing. It's this complex mix of your body's unique design, your daily habits, your overall health, and yep, even your genes. Your hands tell a story about all of that. So the real question is, what story are yours telling you?